The surge in Omicron cases is once again putting the strain on hospitals, especially in rural areas or places that already baseline have not as much care. And it's not just the unvaccinated people who are suffering. Obviously, unvaccinated people are largely the ones who are now in hospitals, and in a couple weeks, we're just gonna see how bad it is. But it's people who are awaiting emergency medical procedures that are not COVID related, whose needs are now being put on the back burner. So that applies to an Iowa man named Dale Weeks. So Dale Weeks was a retired superintendent in southern Iowa who went to Mercy One Centerville Medical Center on November 1st after he began to feel ill. Weeks was diagnosed with sepsis, which can be treated, but the hospital had no open bed for him. At the time Weeks was admitted, Iowa was in the midst of a fall surge that resulted in more hospitalizations than at any other point of the pandemic, save for last winter. And he was admitted, but at a hospital 80 miles away, and he was given intravenous antibiotics, but nothing more could be done to treat his infection. Finally, Weeks was taken to the University of Iowa Hospital on November 17th and was another 9 days before he underwent a 17-hour stomach surgery to treat what one surgeon said was the worst infection he'd ever seen, the Register reported. This is according to Vice News. Weeks did die on November 28th at the age of 78. Again, from sepsis, which could have been treated earlier. His family is pissed. His family is saying that it is because of the unvaccinated that are clogging beds. This is from his daughter. They told my dad and his wife right away they had no beds. It's infuriating that people who are not vaccinated are clogging hospitals up. And just for some context, especially in Iowa, as of Tuesday, unvaccinated people made up more than 80% of COVID-19 patients in that state, and 83% of those in the ICU, according to the state health department.
Yeah.
Here we go again.
So look, we're doing what I guess is a controversial poll, but I'm gonna explain why we're doing it and why I voted yes. Should hospitals deny care to anti-vax patients, giving priority to those who have heeded CDC guidelines and taken the vaccine? That's the question, okay? And that's at tyt.com/polls. So it's a real question because hospitals have to prioritize. If there's too many people and not enough beds, you have to make a decision. It's not optional, okay? Now, how do they prioritize today? They prioritize on first come, first serve. And we've come to accept that as normal and fair. But is it? Is it fair? So if a bunch of people who said, I don't give a damn about no scientists and goddamn doctors, I'm not gonna listen to that man. And they didn't vaccinate, and then they got really sick from coronavirus and have to go to the hospital. Is it fair that they get priority over someone who has an infection and can die if they're not admitted to the hospital? I don't think that's fair at all. The guy who got the infection didn't ask for it. It's not his fault. Whereas the unvaccinated did ask for it, and proudly so. They brag about it all the time. Oh, so what? So what? We're not gonna do it. We're gonna get sick and it's gonna be awesome. It's just like the cold or the flu, who cares? It only kills fat people and old people. That's the thing that they've been saying. We proved it last night on the show.
Yep.
Over and over again. They just keep saying, all right, who cares? It's just fat people. All right, then who cares right back at you? If the hospital is full and if they're unvaccinated coronavirus patients, they should be removed from the hospital to open up a bed for someone who didn't ask to be in the hospital.
We can call them freedom centers. You know, they can just go there and be free. There can be like there could be like Starbucks workers or pretending to be Starbucks workers, and they can like, spit in their faces without masks on. Obviously that person would be wearing, it'll be a whole like play acting of their fantasies, but that's what they wanted. If you wanted to be free, then suffer the consequences for your so-called freedom or your supposed freedom. But meanwhile, again, just like gun control, you're taking the freedom away from all of us to access, oh my God, for the love of God, like to access the small sliver of healthcare that a lot of us already are just clutching onto with like one little finger, right? Like the one time we need any kind of medical attention in this country. We know as Americans, because we get gouged, that we wait and we don't go to get checkups. But the one time we do, What happens? It's full of unvaccinated people. And meanwhile, the private insurance industry they're making money off these unvaccinated people. That's not free.
Yeah, so I love the phrase that you used. They're constantly talking about their freedom. Great, then the hospital should give you freedom to get the hell out. You're free to go, you're free to go. You didn't believe in doctors, what are you coming to doctors for? 99% of the doctors say you should get vaccinated, but you said you didn't believe in them. So why are you coming to visit a doctor? You are free to go, move along. Now the right wing says, oh, this is outrageous, this is discrimination. No, it's not. You wanted the disease, you got the disease. We tried to help you so you wouldn't get the disease. We tried to save your life and you wouldn't listen to us. And by the way, it's not a ghetto for the anti-vax people. If an anti-vaxxer breaks their leg, they should go to the bottom of the line. No, they should get admitted right away. If they have cancer, they should get admitted right away and they should keep their hospital bed. No question about it. It's not to discriminate against them randomly. We don't hate you, but guys, you have to understand, it's real. Whatever is real, the right wing says you're politicizing it. But that person that we just told you about actually died. And they definitely died because they couldn't go into a hospital because they didn't have enough beds. So, and who were the beds taken by? Definitely the unvaccinated clowns who got coronavirus. So why did he have to die? Why did he have to die? Because it's not theoretical and it's not a movie. It's an actual human being from Iowa and he's actually dead. And by the way, of course he's not alone. Go ahead, Francesca.
Yeah, and I just wanted to say, but he's not alone. And in this fall and now winter surge, I have to read two more stories real quick. So in August, a 46-year-old US Army veteran, Daniel Wilkinson, went to a hospital in Texas suffering from gallstone pancreatitis, a treatable illness. While doctors raced to find a hospital with the capacity to treat him, he was airlifted to a hospital in Houston, but it was too late and he died. So he could, again, basically shopping for hospitals. This next story is even more ridiculous. This is in September. 73-year-old Alabaman Ray Des Moines suffered a cardiac event and died after being turned away from more than 40 ICUs that didn't have the capacity to treat him, his family said. In honor of Ray, please get vaccinated if you have not, in an effort to free up resources for non-COVID related emergencies, Des Moines' family wrote in his obituary. I mean, like, this is like worse than Carrie Bradshaw not calling 911 when Big had a cardiac arrest. I mean, honestly, sorry, I just had to throw that Sex and the City reference in there.
Leave it to you to lighten up a super serious story, but she should have called. Okay, look,
she should have called.
Last thing here, and look, maybe a lot of progressives will disagree with us because they'll say, no, look, that could lead to other consequences. You don't want to set that precedent at hospitals. It's interesting. So go to tyt.com/polls and tell us what you think. But guys, the last thing here is Ray Des Moines from Alabama is dead. He had a heart attack and 40 hospitals said, no, we're filled with unvaccinated patients. Go die somewhere else. So we're trying to save their lives. It was one thing when you were playing with your own lives. It's another thing when you're playing with other people's lives. And so right wing, I know nothing will ever get through to you unless it's in the form of a conspiracy theory or told to you by a lunatic in right wing media, but I'm gonna try anyway. Do you understand that you're playing with other people's lives and then you're laughing about it and saying, I don't care if your loved ones, your family members, your dads, your moms die? Do you have any idea how indecent and immoral that is? Because it's happening, and it's not just happening in California where I guess you wouldn't mind if people died because you want to own the libs. It's happening in Alabama and Iowa. It's happening to your family, your friends, and your neighbors. So for God's sake, can you have one shred of decency and look to protect yourself as well as others? And I can tell you ahead of time, the answer is going to be a resounding no. They will not do it. Thanks for watching the Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.